I'm going to do this because I had that as an answer. Wash your hands before you remove your mask. Welcome back to Facebook Live. I'm Dr. Annette Mercatante.
And I'm Justin Westmiller.
And we're here to answer your questions. Go over our most recent week's data. Let's get right to the data and then get to your questions. So, no surprises, we're getting into trouble. We're getting into trouble with new cases daily. We have now an average about 14 new cases daily. You can tell from our perspective internally, staff is getting a little overwhelmed with all the new cases that are coming in daily. So we're working hard to keep up with that, but we're kind of almost back up to where we were struggling last time. We have a few more deaths to report, 2 more deaths specifically. We're up to 62 deaths, and our percent positivity for our testing is close to 4%. So our next slide, I think, is the most compelling one, and that is our ongoing graph of 7-day averages of new cases. And you can see at the end of this graph where I kept talking about we're going up, but we're going to stabilize. Well, if we are stabilizing, we're stabilizing pretty darn close to where we were at the peak of the beginning of this in April. If you remember last April, maybe we weren't doing this then, but I know Justin and I were looking at each other going, it's coming. We were bracing ourselves for the worst. Our hospitals were starting to see a lot of activity, and we were scared. And that's when the lockdown came through, and everybody went home. And within a week, things got really stable again. And so we're going to talk. Probably, I'm sure there's going to be questions about that, but we are staring that curve in the face again.
And the comment I made was, we are, there's a train coming down the tracks, and no matter what decision Doc or I made, we couldn't slow the train down. About where we are right now.
It's a scary feeling. Scary feeling. It's an uncomfortable feeling. We're going to get through this. We're going to stay positive.
Yep.
We're going to do everything we can, but we may have some roads a little bit ahead of us. The next slide is, again, just the amount of testing that we're doing. Our percent positivity is average from the very beginning. We're going to see that slipping upwards as the numbers go up a little bit higher. Again, kind of one of the magic numbers the state is using for percent positivity is 7% positive testing. And many feel that after that 5% mark is where you start seeing a lot of accelerated new cases. And as usual, please go back to our dashboard to look at day-to-day changes. But we are starting to see, as I mentioned, average daily caseloads that are pretty comparable to what we saw in April.
Right.
I would also add that, just as an anecdotal component, that the types of cases we're working up are a little more complex. So staff is mentioning that for every positive case, there are more contacts, more complex contacts. People have been more places, and I think I mentioned this before, but what that tells me is that many people are not, in fact, staying put the way we would really hope them and need them to be. So if you become positive, ideally you could say to us, well, the only people who have been exposed are my family and maybe 1 or 2 significant other people in my life, instead of, well, I've been to the store and I was at 4 restaurants, etc. So that's just kind of a this issue, but that is something that our staff
already.
Okay,
and you kind of already covered this, but in case people didn't hear. Our cases are moving up. Are we headed for another stay-at-home order?
well, I'll say this, our cases are going up, and I think we're heading for at least a period of time get sick, and we're starting to see those positive cases spill over into our more vulnerable people. So remember, in the summer, there's a lot of young people, they were positive, but they weren't really getting that sick. Well, we're starting to see that spill over into the older generations, older people with other so we're going to see more people getting sick, and getting sick enough to go to the hospital and not be able to work, etc. So I'm confident we're going to see that. That's not a good thing, but that's where we're at. Whether that results in a stay-home order, politically and legally, that is a whole different question. There are all kinds of balls rolling about who's going to do what. As you know, the health department has capacity under the public health code to quarantine and to issue orders. But more importantly, I think the question I want to pose to all of you that are listening is, should we go into a stay-at-home order? Should we go into stay-at-home mode? Okay, now forget about orders. Stay-at-home mode, and my answer to you is unequivocally yes. We should all be staying home now, okay? So if you're planning a party, maybe do it virtually. And I'm sorry for all you business owners, but now is not a great time to be out and about doing things without a whole lot of concern. Should be very concerned.
Clarify though what you mean by that with schools, for example.
Well, we want to keep our schools open. In fact, I think schools are not contributing to this. From our investigative process, students are not greatly contributing to the vast number of cases. They're not sharing it at the school. When we get cases within the school, they are inevitably coming from someplace outside of the school where they're getting exposed and infected. So we want to keep kids in school because, quite honestly, it's one of those controlled environments that we think there might be some value. We know kids have to have a place to go. If people are going to continue to work, their kids need to be able to stay in school. So I'm not thinking the school at this point is the source of transmission. I believe it's everything else. Okay? I think it's the socializing, just kind of letting our guards down. And I don't want to blame socializing on everything. But of all the things we can get rid of, I'm sorry, socializing is one of them. We want people to work, keep our economy going, and we want our kids to stay in school. And if that gets out of control, then we'll have to have those broader discussions about not doing anything.
And the one thing I'd like to point out is the higher the transmission rate goes, the more opportunity we have to lose the schools, and
the businesses.
So whatever you can do to minimize that, we can keep going on the path we're going currently. That's what we need you to do.
Okay, next question. Justin, you might be able to answer this.
Okay.
Do you have a link for installing the Michigan COVID Alert app on our phones?
So Michigan has created an app. I believe it's Michigan State has created an app for the university and the surrounding East Lansing area. Michigan as a whole does not have an app
yet. There yet.
Yeah, we're not quite there yet. But I do know that this is a test bed for further movement on that. There is not a whole state app at this point.
And let me just clarify too what one of the issues might be with that, because I've gone over this before. We currently have, I don't have Brandon to do the math real quick, but approximately 120, 130 active cases, and that's going to change a lot because staff is working hard to investigate the new cases, which means the ones who are ready to get removed from active are still not getting removed. We'll get there. But my point is, for every case that we know of, there are probably 10 cases that we don't know of, which means you can't move around with the idea that if you know where all of these diagnosed cases are, that somehow you can avoid them, because there's a lot.
249.
249. Oh, we're up to 249 cases active. So, okay, do the math. About 2,000 people, pretty good chance that you go somewhere, there's going to be a positive person there that doesn't know it themselves, maybe just feeling a little bit under the weather, or maybe is asymptomatic. So keep that in mind, that even with sophisticated electronic equipment, it is in fact your behavior that's going to protect you. Your behavior. Other people's behavior you have no control over, but you have the behavior ability to back off and hunker down and not do all the things that we know are nice to do, but maybe now is not the right time to do them.
Yeah, and another clear, with that number, we know that in September we were at 19 or 20, and obviously we've grown exponentially since then. So we are keeping a close eye on things like doubling like we had in April, and we're not there yet. and we hopefully won't get there. So those are the things we're trying to avoid.
Somebody mentioned that the audio was horrible and cutting in and out. Hopefully that's resolved.
Could you fix the audio, please?
Yeah, it has been fixed.
Yeah,
Sorry.
So we apologize in the beginning. We had a small equipment failure, and
Prior to it?
yeah,
All right.
well, as we were live, so
Okay.
it appears to be worked through because my staff is
Somebody asked
relaxed
the
again.
question, I'll answer this because it goes along with what we're talking about, but do you feel gyms are safe to return to? And I have to say yes and no, okay? So I know exercise is important as it gets cold. Having a place to exercise is important for you both physically, spiritually, and for your body. If your gym is not following the recommendations of the amount of space and masking during that time, I would not exercise in that gym. And I would say 6 feet's probably not adequate between people who are actively exercising and breathing heavy. And I know it's hard to wear a mask when you're exercising, but if there's other people in that room with you, you really should. The CDC came out with a recent publication that a recreational hockey game resulted in more than 2/3 of the individuals getting infected because of one person, because they were skating around, and just that exertion and that breathing is really problematic. So if you're going to use a gym, please be very, very careful and watch, and don't go in the gym if it's crowded, and don't go into that gym if they're not following the rules. Okay?
Do you want to say it? Go ahead.
The cases?
Yeah.
Justin, can you clarify the number of active cases? They heard 49,
Nine.
but we're showing 187 on the update.
Yeah, so I did the recovered versus total cases, and that's where I came up with it. You know.
And I mentioned that my staff is struggling to take the recovered out of the queue, and so that may not have been reflected
249.
here because we have told them to prioritize the new cases, right? That
Yeah.
makes sense. So if they have to work on something, they're going to work on new cases, which means the people who are recovered are going to stay in this queue and be counted and be removed later. So it is a constant work. I mentioned that people get added and removed as the investigations proceed. So I think, again, the broader picture is not whether we're off 5 or 10 people as much as the fact that there's a lot more active cases in the community now than there was a week ago.
Yeah, and the point, like Doctor said, the point was we are not where we were a month ago, and it's alarming stage, and so we're trying to calm that and get it back down, and that's where we need help from the public.
Okay, next question. Who sends out the letter if you test negative? I got tested October 5th and still am waiting on.
Oh, I got that question. So the question is, I tested October 5th and you're still waiting. Oh, call whoever tested you, call. You should know by now, okay? Or your test was misplaced. Something happened. You should, most of the time we're waiting 48 to 72 hours, I would say, for most of the tests, even the ones that get sent out. So if you have not heard about your results, you need to call back. Every one of these facilities has kind of a different process of notification, but my understanding is they all notify as soon as the results are back.
If they get tested here,
Yes.
if they are positive, they receive a phone call from us.
If they're negative, they
If
get a
they're
letter.
Negative, it is sent via USPS. So
Okay.
that is a
So if
Yeah.
you were tested here and you didn't get your letter that says you're negative, please call us. Your letter probably got lost. I don't know. The Postal Service is just right there, right? So follow through with that, please. I would hope that it means you're negative, but I would not rely on that. Call us back.
Okay, next question. Thank you for clarifying that the schools are doing well.
Schools are doing well.
Where are the current sources you mentioned? Socializing, does that imply restaurants and businesses?
Okay, so the question is, schools are doing well? So far, so good. None of the cases that we've identified caught it from other kids in their school, at least that we can tell. I mean, we don't have the type of virology where we can do genetic testing and match them or anything like that, but just from our investigation. The kids and the staff that we have identified generally are exposed in their home environment, either from other people in their household or from their work environment. And restaurants, we don't really track too many people to restaurants, as people don't really tell us, oh, I went to this restaurant. We do have some restaurants with positive staff cases, but almost without exception, there has not been a great deal of public exposure, and the ones that have, we put press releases out. So I don't think going to a restaurant is necessarily the problem. It's doing other stuff.
It's the parties and
It's the stuff,
yeah.
right? Think about where you'd be in a room with a few other people hanging out for an hour, okay, talking to them. If you're at a single table with your family and a waitress is coming and getting your order and walking around, that's probably not the high risk. The high risk is the person at the table with you. We have had exposures, people going out to lunch together, okay?
Yeah.
So the problem's not the restaurant, the problem is the people that you're sitting around with. I hope that helps.
And the same goes for businesses, right? Most of our, if not all of our businesses are doing their part. Yeah, they're doing their part to keep this thing rolling the right way. It's the unplanned, some of the planned gatherings. That's where we're really struggling.
And I know the kids are really struggling. This is homecoming time, and these are hard decisions for parents and students to make. But those are. I just want to say for businesses, MIOSHA did release their own business restrictions. So regardless of where you fall on the governor's emergency orders, mask restrictions are still out there and valid. Occupancy restrictions for indoor and outdoor venues are still very much real and valid. And now the businesses have reestablished. It's the same. They haven't changed, but they have been reestablished and reformatted under the MIOSHA legal
Yeah,
piece.
and basically what they did is they created what's called the final rule. And for MIOSHA, that's where they get their authority through what's called the final rule, and they did create one of those for what we're dealing with. I want to clear one thing up too. Our data person got to me and he said, Justin, you need to remove the deaths from the recovered.
Oh.
So we are at 187, not 249.
There you go. That's why I surround myself with great people.
Say it one more time.
So if you take 1223 minus 974 minus 62, you're at 187.
Right, because we don't want to include people
Yes,
who've died as
right.
recovered. Right? Thank you for that.
Sure.
I forget about those details.
Me too, clearly.
We have something else to clear up.
Yes.
Dr. Mercatante
Yes.
mentioned that if somebody does not get their results in a timely manner, that they should call. We want to clarify that we do not want people calling the health department asking for their results, because we do have people doing investigations and we don't have anybody assigned to look up the results and do that.
Well, if they haven't got the results in over a week, what else are they going to do?
Well, they can call their provider, I think is what the goal is.
Right.
If you've been tested at the health department and you haven't heard anything, it's probably the right thing to do to call the health department.
I know. We're getting lots of calls. But I'm sorry, if we tested you here, and you have not heard from us in over a week, you need to call us.
Yeah.
They need to call us, and we got to figure that out then, because people need to know for sure what the results are.
If it has been over a week,
But do wait for that letter to
then
come.
2 or 3 days.
And I'll reiterate that if you're positive, you're going to get a call right away, and our results are coming back within 48 hours, maybe 72 hours at the most. So if you're positive, you're going to hear from us. I can guarantee you that.
Okay, next question.
Yeah.
Dr. Mercatante, can you shut things down for St. Clair County?
Can I shut things down for St. Clair County? Technically, yes. I
Yeah,
believe I have
technically,
that authority
yes.
through the Public Health Code to quarantine and isolate and close things down. Would I close things down globally? I don't think so. I think we would try and be a little bit more focused on what we're doing. And I think we'd be focused based on where cases are coming from, where compliance is an issue, going back to kind of control this. And I think as a region, we're going to get a lot more bang for our buck if this is done regionally. For instance, when you look at where people work in St. Clair County, a lot of times it's not in St. Clair County.
Right.
So there'd be some limited value in shutting things down in one place and not having a concurrent issue somewhere else. But to answer your question very specifically, yeah, I do have that authority, but I hope to use it in a very targeted and effective way.
And
if I have to use it.
minimal, right? Like
Sure.
You want to do the least amount of compliance.
Well, I don't want to add more harm to
Right.
what's already
That's
happening harm. So again, it has to have some definable value
Right.
for us to move forward with that. And that value has to be considered, because let's face it, it harms people to be told not to go to work and not to do the things that they need to do. That
Right.
we understand that is harmful as well.
Do we know how many people are hospitalized?
Currently, I don't. And I asked that question. I believe we had a 3%
Yeah.
of our beds earlier in the week. We had looked at that. Maybe it was the Friday one. 3% of our total hospital beds were COVID related.
And through my phone calls today, that's about where we are.
Yeah.
Yeah.
Now, the question is how many total beds are there in a hospital capacity, and that varies a lot because it varies on their staffing, whether they've opened up extra wings and extra beds. But from my understanding, the hospitals are not seeing increased COVID-related emergency visits, nor are they utilizing any kind of extra capacity strategies to deal
Right.
with it, which they were last time. We were starting to shift beds into COVID units. People were making those adjustments internally in the hospitals to facilitate the ability to care for COVID patients, and we're not seeing that yet.
Next question. What happened to the call from the health department calling when you've been in contact with someone who has it?
Oh, so now we're talking about, will you get a call from us if you're a contact? In other words, if we're advising quarantine. And the answer is you should get a call from a service that we're using, Traceforce, and they will identify themselves, I believe, as the health department or on behalf of the health department. Those names get put into the queue. They're sent up to that Traceforce, and they call usually within 24 hours, although they're not always 24 hours. So you should still get notified. But that is, in fact, if you've been identified by the case. Some cases don't always tell us all the people that they have been in contact with. They may not give us names and numbers. They'll just give broad, oh, I was at, this party. So if we don't have your name, you won't get a call. If we do have your name and number, you should get a call if we identify you as a close enough contact that you should be quarantined. It should still be happening.
And I know
it's not perfect.
You say this every week, but can you reiterate the importance of being honest with our staff?
So I say that every week, and
Yeah,
I mean
absolutely.
it. So if you've been identified as a case, you have been told you have COVID, and we call you and we're talking to you, number one, pick up the phone and talk to us. And please be candid and honest with us. We're not trying to harm anybody, but through our discussion with you, we're trying to find other people who could be harboring and spreading COVID themselves without knowing it. It's here for your benefit, and we're not the COVID police. We're really trying to just, again, try and slow this transmission. And it really relies on you. If you don't tell us, we're not going to know.
And
Right.
it's now as critical as ever to do that and to
Probably
help.
more critical
Right.
because we have this politically and legislative. We don't have, so at the beginning, the whole country was like, and we had
Right.
that capacity to shut down. I don't think we're going to get that cohesive response this time around, which means that it's all going to rely on us, you, the communities that you're living in, the smaller communities where you interact. It's going to rely on you to do the right thing. That's why I put that op-ed out about do the right thing, because you can't rely on a knight in a white horse sweeping in and making this all better. You know what to do. You need to do it. Okay.
Next question. Someone wants to know, is it safe to go to church?
It depends. Is it safe to go to church? It depends. If your church is not doing the right stuff, no. We've had outbreaks in churches. We've had some pretty big outbreaks in churches. We have some churches that don't even get together anymore. So, if your church is doing everything virtual, it's safe to go to church. If your church has 10 people and they're 6 to 10 feet apart and they're all wearing masks, I think you're okay. I think it depends. as we get more and more cases, if there's people in that church, the congregation, I think they call it, if the congregation is not monitoring itself for illness, you might want to be a little bit more careful. Singing is a problem. There's been a lot of documentation of transmission of the virus with one ill person who's been singing. So I think singing is a little problematic, having a lot of that in your church. If you're going to do that, that singing person should be far, far away. And I know that's part of worship, right, is singing together, but I'd be careful about that.
Okay, somebody mentioned this, which I missed, and then somebody mentioned it again. How come you two aren't wearing your mask and aren't 6 feet apart?
Well,
Because
we
go ahead.
are pretty close to 6 feet
Yeah.
apart. It just doesn't show. If you look at this banner behind us, it's about 6 feet wide. So that's kind of where our spacing is. We are farther apart than it appears on camera.
But we also have to talk to you.
Right.
And one of the exemptions from mask wearing is if you're doing public speaking and you need to express yourself and speak. So as soon as we're done, we
They go
mask
right back
up
on.
again.
And when
You
you
don't
have
see the staff here, but they're
Everybody's in
masks.
masks, yeah.
And we're doing our best. We're doing our best.
Okay.
But good question.
Yes.
Mask police, right?
Somebody said, thank you. I called twice this week and just got told to wait a couple more days. I'm just frustrated from quarantine.
I know.
Yeah.
I know. It is hard. And here's why I'm going to tell you this. It's going to get harder. So when we had 2 cases a day, 5 cases a day, man, we were on it. I think, and our staff is working really hard. We have
7
up.
days a week.
So we have 7 days a week now. We have, we've tapped into our volunteer staff. But when we start getting into 20 cases a day, some of you guys we're not going to get to you right away.
That's hard to keep up with.
We're not going to get to you right away, which means you have to know where to find the information. Our website's a great place. MDHH has great information. We're going to do our best to talk to you and call you. But, again, there's only so much we can do, and the rest of it is really up to you. And I know quarantine's hard, but you know how many days you got to quarantine? It's 14 days from your last exposure. Just do it. Just do it.
So here's
Okay.
a hot topic because Halloween's just around the corner.
Halloween.
I've answered a lot of these questions. yeah.
Number 1, what about kids and trick-or-treating? Any suggestions? And then what about people hosting Halloween parties? So start with trick-or-treating.
You want me to take that?
Go for it.
Yeah, so I've answered a lot of these questions this week and in the last 2 weeks. What I'll tell you is MDHHS and the CDC have both put out guidance on trick-or-treating. So far in the county, I don't believe anybody has said we're not doing trick-or-treating. But there are ways you should, right now, a couple things. Only travel in familiar units, in your family units, while trick-or-treating. Try and keep those large groups to almost don't do it.
Don't have a party.
You don't have
Don't
a
have an
Halloween
in-person party.
Right.
Do it virtual or.
Yeah. A couple other things you can do is for the people passing out candy, instead of physically giving it to each person or each child, maybe create some sort of, put a bucket out there and with a sign that says please take 1 or 2, something so you can create the distance. Remember, the key to this whole thing is distance between non-familiar units. So that's basically what the guidance tells you, and that's what we're telling all of our community.
Okay. My 87-year-old mother is playing cards with 8 people 4 times a week. Is she safe doing this in a private home?
So the question is, you have an elderly person who we know is increased risk for if they get COVID or having a more serious illness, and she continues to play cards with her friends in somebody's private home. And is she safe? I'm going to go back to the word. I'm never going to use the word safe in this environment. The only safe place to be is in a bubble where you don't expose yourself to anybody and then nobody exposes to you.
Right.
But so you have maybe a handful of people who are all doing 1 or 2 things every week, and I'm assuming that the rest of the time they're not doing a whole lot. So they've created their own social bubble. We've created a social bubble here at the health department. Justin and I, my family at home.
Right.
And when I go home, I don't put a mask on. We play cards. I have a core group of people we do that with. And we trust each other that we're not going to go out and expose ourselves in other ways. That's our exposure risk right there. I think if you maintain that and you make sure that people don't continue to go and play their cards if they're sick, and if they have other exposures, that they self-quarantine themselves during the time frame to know that they didn't bring something back into the bubble, into the circle. You might want to call it a pod, whatever you want to call it. Then I think those kinds of activities are okay. In fact, they're kind of necessary for our sanity, right? And you got to do something. But I think you have to take each one of those situations and look at it very critically and ask yourself, is the whole group abiding by this kind of a rule? Or do you have two of them doing it and the other two that are just really not paying any attention at all? And then there would be a higher risk in those situations.
Okay, we're past 4, but.
We're past 4.
There's a ton of questions, I bet.
If you guys are okay keeping going,
Yeah,
I'm okay
I'm
keeping
fine.
going. All right.
Okay.
Doesn't cost us anything to keep going, does it?
Nope, we're free.
All right.
Okay.
We're free. Nothing's free.
Ah.
Nothing's free.
Marysville School Board is voting tonight and going back face
Oh.
to face.
And
What are your thoughts?
So I will be there tonight to provide, we've talked, Doc and I have talked, and I'm going to provide some data and some input should they request it. But basically, this one's a struggle, right? We know that there's significant, as Doc has talked about, that there's significant negative impacts to kids not being in school.
Mm-hmm.
However, Marysville schools voted not return due to the threat. And what I will say is the threat is not better, it's worse. And so I think the school board has a tough decision ahead. Doc, what do you think?
Well, I would agree. There's a pro and con to everything. I can say that the rest of the school districts that are engaged in different levels are all kind of limping along. They're about, in fact, I would even say that even Marysville, students involved with Marysville, we've had cases.
We have,
they're just cases. They're not in school. They're doing other extracurricular activities, right? So no one's exempt from this. And I think if they do it carefully and they engage, we'll see what happens. We're at that place right now. This community is at this place. In fact, the whole state. We're really at
We're right on the edge of the cliff.
We're right
Yeah.
there. And if things get a lot worse, then my answer would be no, it's probably not a good idea. Can they get started and keep kids in school? Maybe.
Right? But
Yeah. I was a lot more confident saying this.
in September.
In September,
Yeah,
right?
very
I was
much.
like, yeah, you're going to do it.
We're
Now's
doing
a good
fine.
time.
Yeah.
Now
we
is
are
a
not.
tough time to do that. And of course, if they bring everybody back and they have a bunch of cases, it's their fault. And if they don't do it, it's their fault.
Right.
It's a tough decision.
It's a no-win situation.
You can try and see what happens and just pull back. That would be one option. Or just wait until we're past this next peak and do it then.
Here's a great question.
Great question.
Why do you think so many people don't believe how serious this is? And I'm astonished by the amount of people who call this the flu.
You want me to take that one too? At
Well, you
least
can
to
start. I
begin?
have my own opinion about
Yeah.
that too, though, so go ahead.
Yeah, so it's my opinion personally that nationally we've struggled with a good way to manage this on a whole of nation or a whole of government response.
Consistency.
Yes.
Yeah.
So that is definitely not helping. We're getting different messages from the administration than we are from the CDC. We're also getting, doesn't officially view the WHO. We're getting different information from them too. So people are latching on to all of that and they're saying, well, this doesn't match with this. I can't believe any of it anymore. And so I'm just going to do my thing on my own, which is a dangerous place to be. What I'll tell you is in St. Clair County, we are being very, very transparent with the data, and we will answer every question that you send us without fail.
Right.
And we try to keep it as apolitical as possible because it's our duty to tell you the truth, not what you want to hear.
Right. So I'll just say, I think, unfortunately, and here we are, to hopefully everyone's benefit. But I think when you look at social media, I know when I look at it, I'm kind of stunned at some of the stuff I see.
Yeah.
And clearly false information. But when you see it over and over again, and there's no rebuttals,
It becomes the truth.
It becomes the truth. So
Right.
you got to be careful, be critical of what you're seeing on social media. People are repeating things over and over again. You hear them enough times, it starts sounding like the truth. But and be careful what you share. Okay, if it sounds a little odd, don't share it. Okay, try and just let it sit there for a while. And I think, honestly, some of the misinformation, this information overload, is really contributing a lot to this. I think the second issue, though, is when you have something this big and this is big, and it's hard for wrap our heads around it because it's scary, and so when you do that, you tend to push it away. Right, it's a cognitive dissonance. You just this is making me uncomfortable, and therefore I'm going to think about something else that's more comfortable, like the whole thing isn't real, or the whole thing is just contrived for some other reason. And I think that's human nature, but it's Justin, it's kind of dangerous, because by ignoring this, things can get a lot worse for everyone, and that's the problem we're having. So.
And then just briefly speak about the flu question.
Oh, the flu. It's not the flu. It's not the flu.
It's not even built the same.
It's not even the same virus.
Right.
It doesn't impact our bodies the same way. It doesn't get into our cells the same way. The death rate is clearly more severe. This is not the flu.
The infection rate is way more severe too.
And the problem we have too is it has that same, the flu can infect a lot of people asymptomatically, which is why we have difficulty with the flu. This can do, so there's similarities. It's respiratory. You have a lot of people get infected and pass it on without having symptoms. Makes it hard to control, but it is not the flu. It infects our bodies in a very different way. It's impacting different groups of people. As you know, the flu can really severely infect young people, and this is clearly an illness that's nailing people who are older, who have also have other medical problems, by the way, includes obesity, even mild obesity. Okay, so that's a huge problem in our country. Probably close to 60% or more. What does our community health needs assessment say in our county? At least 60% of our community is, at least 26% of their BMI is overweight. You are at risk for having more serious complications of COVID. So these are not things you hear about with the flu. So just get that off your head. Just take it off. It's not the flu.
I just want to share too that a couple people have said you're doing such a great job for our county. Thank you. Several thank yous. So
well, thank you for watching, and share this, please. If we understand what your concerns are, we can do a better job here communicating with you.
And then somebody wanted to know, when will we get rapid testing here in St. Clair?
Rapid testing soon.
Very soon.
I think we're really a matter of weeks away. Of course, we have rapid testing at a couple facilities. MedExpress has rapid testing.
Now on our website, right?
I did get a report though that MedExpress was.
But it's not free.
That's right.
Yes.
Not free.
They ran out of some supplies. I haven't checked on that.
Right.
But we do expect that they will continue to keep doing this, and their supply issue is just a very short-term issue.
We have been getting word from the state that the federal government has pushed them a very large supply of rapid antigen testing, and we are hoping to see that in our hot little hands, hopefully very soon. How we can apply that and who we can provide that to remains a question. This is not going to be rapid testing where everybody in the community can get it all the time. We're going to have to apply that rapid testing for areas that are very specific and need to know. And more to come on that. We'll figure that out.
Yeah, we're working on that plan.
It's 10 after 4.
10 after 4.
And if there's questions that we didn't go over again that were further down in the spread, please know that they can go back and watch this again, because you did cover it. We always post
and
it.
The other thing that's really great is if we find questions that we didn't answer, one of the staff will go back and answer those questions for you. And if they don't, send me a message.
Yeah, and the COVID-19, what's the email again?
COVID-19 at stcounty.org.
COVID-19 at stcounty.org. Somebody looks at that every day. They have passed those questions on to me, to Justin. We try and answer them and get back. We will get back to you directly if we have to. In fact, that's what we do. And so lots of ways for you to get your questions answered. And thank you for joining us.
And lastly, just they can go back and review this video.
And you can share and review this video.
Okay, so closing thoughts, anything else?
Yeah.
Closing thoughts.
You can go first. I always go first.
Hang in there, people. Hang in there. That's all I can say. We're going to get through this. Stay positive. It's just a virus, and it's just a virus. Okay, it's both. It's both good. It's just a thing, and we're going to get through it. We got to do the right thing. We got to take care of each other. And I know you know how to do that, and we're going to do everything we can to support you.
Yeah, and I want to change. I always say, everybody, you know, we're there for you and all that. But one thing I want to say thank you to is all of our county leadership, our community leadership. Everybody's on the same page, and we haven't had any issues. And we continue to appreciate, Doc and I continue to appreciate.
And I'm putting my mask back on, see?
The very hard work that all of our community leaders and our communities are doing here in the county. I don't expect that to slow down anytime soon, but the partnership is a fantastic example of how we can all work together to keep our safety and security and our public health in a positive light. So
and
thank you all.
enjoy the beautiful colors. It's beautiful out there. Get some joy out of the world. Go look at the colors.
Thank you all.
Safe in your car. Drive around, look at it. Bye.
All right.
See you next week.